Great. Okay. Well, I'm going to go ahead and get started. We're going to do things a little different today. We're going to talk a little bit at the front end. We're going to let our speakers talk, and then we'll kind of wrap up at the end with the committee conversation. So that way we don't waste their time. So anyway, welcome today. Introduction of guests. I will say that we have Angie Bailey with SIH with us today, and Kerri Gale with Jackson County Health Department, and a special guest with Rotary, Amy Allen. Maybe Shane could talk a little bit more, or if Amy wants to introduce herself, that would be great.
Sure. So yeah, my name's Amy Allen, and I am your District 6510 membership chair. So I wanted to make a point of jumping on at some point, and was able to get free today so I could say hi and let you guys know that you have my full support. So if there's anything that you guys need, or if you have any questions, or if you don't want to just bombard Shane with more, so you're more than welcome to holler at me, and I'll do whatever I can to help assist you guys. So.
Okay, thank you. Somebody else joining us. Well, as always, the Carbondale Rotary Club is tomorrow at noon. It's weekly on Wednesday. As far as I know, the link is still the same as it was last week and the week before. The annual fund challenge continues until March 15th. Shane and I actually had some bigger news today. We went through the grant training documentation like last week, and we're both certified for this Rotary year to submit grants on our behalf. So we did submit a district grant actually officially today for $1,500, which means it's $1,000 that we're asking from Rotary, and $500 that would be raised or provided by us. So the project that we decided to go with is a backpack project for the schools. And what we did is, I know personally with my kids going to the Carruthers Elementary School, which is grades 3rd through 5th, that they have, they call it like a comfort closet, but this also goes with, like, they collect snacks. It's more so on the front end of the year, so that they'll connect, or, you know, have snacks for kids, backpacks, any kind of school supplies, as well as clothing that can be used or new. And they have kind of a stash of it for those who need it throughout the school year. What we decided to do is do a backpack project. So basically with as many as we can get within $1,500. Here's a breakdown of the grant that was submitted. So you can see it's broken down with backpacks, and then Shane had used materials supply lists from last year. So anyway, it's not set in stone. We do not have to use this exact amount for each exact item. So, you know, we'll take the new school list and build it from there. And anyway, we're hoping to have not just like cheesy backpacks, but nice backpacks. I know there was a kid in my son's class who went through a new backpack every couple of weeks that was given from the school, and they were like Mickey Mouse, and he was in 3rd grade. So my son felt really like he needed to have a cool backpack. So something that didn't scream that it was from the office. So that's my goal with this. So we will be talking about, you know, later on how we're going to raise these funds. I know personally, I plan to just contribute because it's it means a lot to me, this project in itself. And we can't spend any of the money until July 1. And we're hoping to have this completed by the end of August. I feel like this would be most beneficial on the front end of the school year. And then that way they can be given out to the students during that time whenever it's requested. So does anybody have any questions on that or anything that you'd like to add?
Did you say Mickey Mouse wasn't cool?
I don't think so. Maybe for like the general. So we were hoping that, I know like last year or this around the Christmas time, they had like Nike backpacks at Sam's for $30. So I was thinking of something like that, you know, not trying to get the cheapest of everything to make it something that they would be proud to wear. Any other questions? Okay, great. Well, at this time, I'm going to go ahead and introduce, again, I guess, our guest speakers, Angie and Kerri. So I will give it to you guys. Did you want to share your screen? Did you have a PowerPoint, or were you just going to talk?
I was just going to talk.
Great.
Yeah,
Angie,
I can maybe share my screen a little bit, but do you want to go first, Kerri? You want me to?
I can start whatever you want to do, Angie. I can go ahead if you want.
Yeah, that's fine.
So I'm just going to kind of start with, we have the 2 mass vaccination sites in the county at the Carbondale Civic Center and then at SIU, and we're running those 6 days a week. We're giving Pfizer at this time plus J&J. This week we have Pfizer, and then we're also taking walk-ins for first dose Pfizer and second dose Pfizer if you're within that 21-day range. And then on Saturday, we have Johnson & Johnson at both of our clinic sites. And I know that is what a lot of people right now are wanting is Johnson & Johnson. So also the mobile clinics, that's what they are using right now. If we're getting it, that's what we are redistributing to those mobile clinics because obviously that's easier. You don't have to go back for that second dose. And also this week we have a mobile clinic at the Murphysboro American Legion till 4 o'clock today. And that's Johnson & Johnson. And then on Friday, we are at Bethel AME Church in Carbondale from 8 to 5 for Johnson & Johnson also. So those are kind of our, and we do our clinic schedule by the week. So usually at the beginning of every week, we go ahead and schedule for that time frame. Asking about the mobile clinics, if you're interested in maybe having one at one of your facilities, you can just give me a call or shoot me an email and we will try to get you on our schedule for that. We do rely on the facility to help us with the promotion of that because it's tough for us to do the clinics and the promotions. So we kind of have a flyer that you can insert your stuff into, and then you can promote that to your whoever comes to your facility or anybody else around there. So that's kind of what we're looking at now. We do have some people that maybe got a first dose Moderna and they're looking for that second dose. So they kind of they couldn't come on the day that we were doing it because we offered it twice in March and that was it. So a lot of the places like Walgreens, Walmart, I'm trying to think, some other places that have that, but you can go on vaccinefinder.org and that shows you all the places that will offer those types of vaccines. So if you're looking for that second dose, or you know someone that's looking for that second dose and they're unable to get it through us, then we would, tell them to reach out to maybe some of those other places to see if they can obtain that second dose, not to wait on that. And then I did kind of want to go through some numbers. I don't know if anybody looks at those numbers of vaccinated people within the county and kind of what that looks like. We have administered, us and SIH and everyone else has administered 32,464 doses of vaccine. 15,260 of our population is fully vaccinated. That's 20% of the population. Comparatively throughout the state, we're in a really good place in Jackson County. So I want to thank everybody, all of our partners that have helped us with that. I know that you guys are sitting here on this call and everyone has helped us. So we appreciate that. And do you guys want me to talk about the bridge phase and phase 5? Is anybody interested in hearing about that? Okay. All right. So I know that is kind of a little bit confusing. So right now we are still in phase 4 and we have to go 28 days with all of these increments dropping. Like our positivity, our regional rate looks really good. The county rate has went up just a little bit, but we're like at a 3% positivity rate. But they're also looking at things like hospital admissions, COVID-like illness to the ER, those types of numbers also. So I will, when we get done with this meeting, I'm going to send out some links so you guys can see the bridge phase to phase 5. So we're in that 28-day period still. And so when that 28 days is up, we'll be looking at those numbers to move to the bridge phase. So that's kind of what that is looking like at this time. think that's really all that overview. Does anyone have any questions?
Did I see where the Johnson & Johnson one's only 70% effective?
I believe it's a little bit more than 70, but I do want to say it's 4 weeks after your dose that you're fully vaccinated. So that is, with your Pfizer and Moderna, it's 2 weeks, you have 50%. And then after the 2 weeks after the second one, then you would be at your full effectiveness. So Johnson & Johnson is the 4 weeks. And Angie, maybe you can answer that question. I'm not sure. I think it's in the 80s.
Yeah, I believe so too. And I'm going to share something with you where you can kind of pull up and look at some of those things. And then too, the big thing to remember is how effective is it that's very effective in preventing hospitalizations and deaths. When you look at that, how effective it is in hospitalizations and deaths, I want to say that one was up in the 90s.
Yeah,
so that's what we're really thinking about and looking at and wanting to pay attention to.
So will both of the vaccinations, so it was, I guess, the Moderna, is that like being phased out and just sticking with the Pfizer and the Johnson & Johnson, or what's the future look like for the vaccination selections?
So at the county level, Moderna is given out, that's your county allotment. And so that's why you saw that at first. That was kind of the big one that came out. And then Pfizer is given like our mass vaccinations, and that's the only one approved for 16 and over, Pfizer. So I still think you'll see all three of them. Because the pharmacies also have Moderna also.
And I'm sorry, I had another question. Shane and I were talking about this before. So I know that it said like the Pfizer one, I think, is good for 6 months. So does that mean like this fall that we're going to have a different round of a booster, or how will that go this fall, or what's being talked about?
It has been talked about, but there is no decision that has been made that I'm aware of at this time. Information kind of comes fast and furious to us, so we just try to keep up as best as we can with that. But as of right now, we don't know what that looks like.
Kerri, do you think the southern part of the state will get into the bridge in the next 28 days? What's the numbers trending toward? Is that something you can talk about?
Yeah, actually, I think like our region looks really good, to be honest. And Angie has that. I see this. She's got a link to
I'll
that.
bring you the link up right now,
Yeah.
Kerri. Hold on.
Yeah.
You can talk from it. Is this the spot you want, Kerri?
Yes.
Okay. So, these are the statewide metrics. And Kerri, correct me if I'm wrong, but really the whole state has to meet all these metrics because we're going to move through these phases as state. So there's a lot of, what if our region's doing good? Can we go first? But it's not that. It'll all be statewide.
Angie, we're only seeing your SIH document. We're not seeing the other
Oh,
pop
you're
up.
not? Okay. Well, I see the link. I clicked on it. I can see it on my screen. Let me see if there's something else I need to do.
Oh, you might have to stop sharing and reshare.
Restart. Okay. Yep, here it is. Okay, can you see it now?
I can see it.
Yep.
So as you can see, the statewide metric for the 65 and over vaccinated, that metric is looking really good. And in Jackson, we have 37% of people that are 65 and over that have been vaccinated in Jackson. So the 16 and under or the 16 and over, I'm sorry, that have been vaccinated, that is creeping up, and we just opened that last week. But the problem is with a statewide metric, so we all kind of move differently. So that makes that metric a little bit tougher to get to. So we opened up to all Illinois residents 16 and over last week. So the whole state has not went to that. We still have some people that are in different phases. They're still like in 1B, just doing underlying health conditions. So that makes that a little difficult. And then as you can see, as you go down, the available of ICU beds is good, but the trend that keeps increasing is the COVID-like illnesses that are going to the ER. And Angie, I don't know if you can talk about that from a SIH standpoint, what that looks like for you guys.
Yeah. So with that, so I'm going to just talk a little bit from our daily update we received in-house today. So our total, well, I can show it on let me stop sharing this and share what I was sharing, and I can show you actually the trends that went out with our staff today. And so, okay, you can see my screen now, correct? With some charts.
Yes.
Okay. So when thinking about this data, so this is our data that was shared with our staff today, and I can share it with you because we know as soon as we share it with staff, it's out to the media within 2 minutes. So we know that many are already seeing this. And so what we share this information with staff every day and with the community on Thursdays through our community update. And if you're not already receiving that, I'll tell you about how to get on that list. But what we look at and share with staff is a lot of the data regarding vaccine that Kerri had already mentioned. I'll talk about monoclonal antibodies in a second, but we were just talking about inpatient admissions. So this is actually inpatient. And so you can see these are the months. And so we are actually, let me pull it up. These are the months going backwards. So this month. And so you can see we had a dip, we kind of went down. We are starting to see a little bit of a creep up on the testing. And so you can see it's kind of down and up and kind of all around. So we usually find that when these percent positivities go up, you can see that trend, and our hospitalizations go up and come down. So that's kind of really where we are at right now. The current inpatient data as of today, we had 11 positive inpatient, and 2, those are persons of interest. A couple weeks ago, we were down to like 3 in the whole system. So you can see there, just by looking at these numbers, we're at 13, and previously a couple weeks ago, we were at 3. So we are seeing that creep up a little bit within the system. So, and then the information I was going to talk about is we do send this update out every Thursday. So I don't know, are all of you receiving this update, or some of you, or if you're not receiving it and you would like to get this update on Thursdays, it usually comes out about noon to 1. Then let me know. You can put your email in the chat box and we'll get you added to that. So we just share general reminders. A lot of times these are coming straight from either the health department's website, IDPH, or CDC. So this is the draft. It'll come out to the community tomorrow, or Thursday. So again, just promoting some of the things Kerri mentioned about the bridges and phases, where to go, how to get vaccine, the hotline, and then SIH is also hosting a hotline right now as well for vaccine questions. And then we just promote people to their closest clinic within their county, or if they're looking for a certain one, we'll push them to that. CDC releases new information each week, so we include that, tips on getting your COVID vaccine. And then a new thing that came out last week was the COVID Community Core. So if you are someone who is really interested in helping get tips and tricks and things for promoting vaccine to others, this was released by HHS on the 1st, and they do have that community core you can sign up for. You're not really signing up for anything, except you'll start to get weekly emails with just how to talk to your people about getting vaccinated, some tools, tricks, things you can share on Facebook and other places. And then other types of things we share are new updates from the CDC, information about that IDPH call center, and then our call center. CDC released on the 2nd information on new travel guidance after you've been vaccinated. So that information, as well as our COVID-19 testing site hours and the hotline hours, and how to do that. So is everyone familiar with the monoclonal antibodies, and that's something that if you are a person who has within 10 days of symptom onset, you can still receive that. And then that has been proven to help individuals have less severe symptoms of COVID. So we are still implementing that program as well. And then just again, promoting the COVID vaccine checker, and we still do share the risk metrics, any new science and data updates. And then you can see those monoclonal antibodies. We did have some months where that was a really high. We'd really had a lot of people utilizing that service, but right now we've dipped down, and around 5 a week are getting those infusions in that way. These are our weekly testing trends. So we'll share that tomorrow as well. And then
Angie, antibody treatment, do you have to, is there some criteria in order to get that treatment?
Yes. So it must be within 10 days of symptom onset. And then you need to have a body mass index greater than 25 or have another chronic disease that may make your symptoms of COVID worse than it may for others. So body mass index, chronic kidney disease, diabetes, immunosuppressive disease of any type, or if you're receiving some kind of treatment, anyone greater than 65 or greater than 55 if you have any chronic conditions like cardiovascular disease, hypertension, COPD, or any respiratory types of diseases. And then the other thing is you can't have received the vaccine within 90 days. So that's something to keep in mind as well. So if you got your vaccine a month ago, but you fall in this criteria and you do have COVID, then you wouldn't be able to receive the antibodies. Okay. Any other questions about any of that? So like I said, we are doing the weekly update on Thursday. So if anyone's interested in that, you can put your email in the chat and I'll sign you up for that, and it'll come on Thursdays between noon and 1. Another thing we are working on is a vaccine confidence campaign, because what we're seeing is the health department's doing a fantastic job of having all these available clinics open throughout the region. Every health department or every county is open for all phases, except Randolph County. If you live in that county currently, they are still working through the phases. But individuals in that county, I've heard of many that are actually driving to Carbondale to get the vaccine through the National Guard and Health Department clinic, either at Banterra or the Civic Center. So the other thing, many people they're not having appointments filled up. So one thing that we are trying to work on is a regional vaccine confidence campaign. And so we have a logo, and it's going to have a soft launch of the website probably later this week. And right now we're still trying to find people who are interested in being a partner organization or a vaccine champion and telling others on why they got vaccinated, why they feel it's important for either commerce or health or whatever it may be, on why it's important. And then here is a sample. I don't know if you can see it. This is the logo and the hashtag. Everybody can see that. So this is our shot, Southern Illinois. So that information will be coming out. Anybody can use it. Any business or entity can kind of join in. It's going to be, the branding of it is just, this is our shot, Southern Illinois. It's not SIH branded. It's not branded with another healthcare system, anyone. It's just, this is our shot, Southern Illinois. The website will be ourshotsci.com. And then you could learn more once that's live. So it's not live yet, but later this week, about being a champion or a partner organization. We're going to have flyers. This is an example of a button. So I blew it up and I'm making it a poster for myself, but it's an example of a button that we'll give out on why people are excited to be vaccinated. And then right now, all the health departments are on board to help promote this. Many of the hospitals in Southern Illinois, we have quite a few businesses that are also on board, who have expressed interest in being part of that confidence campaign. So it's kind of a more the merrier. What can we all do to really promote it more and more? Because we are seeing places that have these open appointments and really want to try to increase those numbers so we can move to the bridge and then to the final phase. I know for me, I'm like ready for everything to be back to normal and not to wear the darn masks and, you know, just not to be fearful of COVID and that my friend or family member, if I was carrying it and didn't know, like what could I do? So, and you know, those people that are hesitant or scared, I've heard a lot of business people within the last week say, you know, my employees worried they don't want to get the vaccine on a Tuesday because they're worried they might not feel good on Wednesday or Thursday. So just trying to either as employers be flexible with people with that. And then also, you know, what can we do? I know personally I was worried, so I tried to find a place where I could get vaccinated on a Friday. So if I did feel bad at all, then I would, it would happen over the weekend, so I wouldn't have to take time off. So I think it's just really what can we do to kind of spread the word, spread the message, and tell people the importance. So any more questions for Kerri or I or anything else?
Of the people that are still testing positive, is there a certain group of people that we're seeing that in, whether it be children or unvaccinated or teenagers, or is there a trend at all?
There is a little bit of a trend. So we've had, and I'm trying to say this without giving what I need to keep to myself. So there is a little bit of a trend. So we did have a kind of an outbreak, and some of them, we did have a few younger kids last week. Of those people, you know, we didn't have any hospitalizations or anything like that, but they were people that would not be eligible to be vaccinated. Some of them were in between their first and second doses. And we have seen some people that have been vaccinated that also have gotten it. So, you know, it doesn't stop you from getting COVID, like Angie was talking about. You know, it keeps that hospitalization rate down and all those other things down, so it doesn't stop you from getting COVID.
Any other questions for us?
Well, it doesn't sound like it. So thank you, Angie and Kerri, for coming today and sharing with us some information. I had a lot of questions, I know, and it was good to hear from you guys on the status of everything.
Thank you for having us. I appreciate it.
Yeah, thank you. And I did get the one email in the chat, so I'll add you to the update that we send.
Thank you.
Okay, well, that's all we had from you. So you guys can hop off whenever you want to, and I will move forward with the rest of what we were going to talk about today. So as we had talked about last time, we had talked about committees, and we thought we would hold off, like, you know, we got the bylaws settled. We thought we would hold off a week or two to find out, or just get situated and see what we want to do about the committees. So again, we have 4 committees: membership / public image, the foundation committee, which we thought would launch, you know, a little bit later than today, youth and community services, which like the backpack project would fall under, and then international services. So Shane, did you want to talk a little bit more about that? Because like international, I feel like international and foundation is more like outside of this group. So maybe you could talk a little bit about that.
Yeah, Rotary Foundation, I figured we probably by summer we'll bring in a guest speaker to actually get deep into the weeds of what Rotary International's foundation, what it's used for, where the funds go, how the funds filter through Rotary International to do good around the world, and how those funds actually can rotate back into the club through a district or a global grant process. International Services Committee, at some point, you know, a project may land in our lap where we want to do a project that would have international appeal. So I think it's good to have a committee. We may not be busy in the beginning, but I think it's good to have a committee that's looking for ways to help international communities with maybe a Rotary themed project. And just to break the ice, I'll throw my name as I'd like to chair both those committees if there's no one else that's wanting to do it, because they should be fairly straightforward to build. It'll take a long time to build those committees up. So.
Hi, I'm Harvette. Can you hear me?
Yes, and I'm sorry, Harvette. I meant to, whenever I saw you pop in, I meant to introduce you when we got off that, and I forgot. Sorry.
Oh, that's okay. No, I was interested in international services also, the international committee, and
Great.
being a part or either chairing it, either way.
Wonderful.
How about co-chair, Harvette? How about we do
Co-chair
it
is
together?
great. That's fine. That's good.
Harvette Gray comes to us from the Carbondale Club. So anyway, welcome, Harvette. We're so glad to have you.
Thank you.
And also Dennis joined us during the session too, and Brad.
Also, Harvette would like to join this club and transfer over if everybody is agreeable to that.
Yes, I would.
Wonderful.
Sound good to everybody?
Sounds good to me.
Yep.
But okay.
Looks like a consensus. See how easy that vote is? I'll take care of it from there.
Okay, great.
Really what, like I said, I would like to be involved in the community and youth services. So I don't know, like Shane, without reading the bylaws again, like what, I don't know if I'm supposed to be involved in.
I can walk you through each of those if you want. Inside membership and public images, you just met Amy Allen. She is the district's membership committee chair. Membership and public image kind of go hand in hand. It's the district that wants an individual or a committee in charge of trying to bring in people to Rotary to explain what Rotary is, to shape that image in our community of what we're doing and why we're doing it. The foundation at the Rotary International level is a little bit different than it is at the local level. Rotary Foundation internationally has multiple funds of mechanisms that address all of the global causes, from water to maternal needs to the environment to the the eradication of polio. So they raise money to do those type projects around the world. And like I said, we'll get more into the weeds of the Rotary Foundation at a later date. But if you want to go, do you have the next slide that's got the other committees on it too?
Yes.
When it comes to youth and community services, we've combined two committees. Some clubs have these separate. Youth services can be one, community services another. But if we're going to do projects in the community, probably if you're going to raise funds and do fundraising, that would probably fall under this committee. The backpack project is a good example of a youth services committee. A thing that this committee would need to start working on is how we're going to implement the backpack project above and beyond. How are we going to advertise it? How are you going to work with the membership public image committee to make sure people in the Carbondale-Murphysboro area know what this Rotary Club is doing to help its community? And then moving forward, there will be another district grant a year from now that you should start looking at projects, fundraisers, other things we can do in the committee is to organize those projects and figure out which ones we want to do as part of a grant, and which ones can we do just with our own money. So international services, there are a lot of the clubs in Southern Illinois do water or sanitation-based projects in either Haiti or parts of Africa. There's already established relationships into those international communities. The sponsor club, being the Rotary Club of Carbondale, has provided a washing and dryer machine to a hospital in Haiti. They've done water wells. They've actually gone and done water well digging and setting up of pumping to pump water in parts of Africa. So those opportunities will come, and maybe we may be able to send Rotarians into Africa to help others around the world. So that's a quick synopsis of those four committees, Brooke.
Okay, great. Is there anybody interested in being a part of or chairing the membership public image committee? Let me go back to this one. So it says this committee should develop and implement a comprehensive plan for the recruitment and retention of members, responsible for updating club website and social media accounts. I think right now Shane is doing social media, correct?
Yep. Kelsey, you want to do it together?
That's fine. I was going to say, I don't know what my options are, but I would be the most interested in the youth and community. But I don't mind heading social media.
You decide.
Well, I'd probably rather do the community and youth services if I can.
Okay, so membership and public image, I think, is the only one we don't have anything for. Guess we could hold off till next.
I'll do it in year one.
Yeah,
I'll
mean,
get us started on it.
I know that. I know that Jeff would probably be interested in doing something. I know he's not actually like a member yet, and that he's in Carbondale, and they are very short-staffed right now. But that's something that we could maybe also talk to him about, assuming he can join next time.
Okay.
Yeah, Brooke, you can put me down on it, and we can always transfer it to Jeff if he becomes a member and if he's interested in doing it. But that way we can at least get the committee started and start getting groups together, because at some meeting in the future, we'll just do breakouts and sit around and talk about what needs to be done. And it's a good first step is getting these committees organized. So sounds good.
Okay. All right, so our next meeting is April 20th. Kelsey, did you have an idea yet?
Yeah, I have Joe Fry from the Murphysboro Park District.
Oh, good.
He confirmed that with me last night. I told him I would email him the information as soon as I had it for the meeting. So
Awesome. Wonderful. Okay, and then May 4th, we have Julie White, and I can get with Julie too on any thoughts or if she needs help with anything.
I think if she got a confirmation that she was going to have somebody from Start talk.
Oh, okay.
That was her plan anyway. I assume she's on the board there, so I think she can talk somebody into coming and talking. So
Wonderful. Okay, well, that concludes our meeting today, unless anybody else had anything else to talk about.
I just want to again say welcome to Harvette. Thanks for joining us today.
Yes, welcome, Harvette.
Thank you. Thank you very much.
So
Glad to be
have
here.
you.
Thanks.
All right, well, I'm gonna see, oh, sorry, Shane, you were in here from last week.
You're gonna make me do it again? Four-way test. Let's do the four-way test together. The four-way test of the things we think, say, or do. First, is it the truth? Second,
is
is
it
it fair to all concerned? Third, will it build goodwill and better friendships? Fourth, will it be beneficial to all concerned?
Okay, well, thank you, everybody. It's 12:45 and we are done. So thanks for joining us today.
you?
Thank you. Thank you.
Have a great day, everybody.
Hi.
Be safe. Bye-bye.